The final report. Who are the interpreters of non-invasive studies? Non-invasive vascular examinations must be interpreted by the medical director or a member of the medical staff who is listed in the application of the testing facility. The final report represents the final interpretation of the non-invasive vascular examination. It is a legal document and must be in the form of a document that is retrievable and/or reproducible for review by healthcare personnel. The final report must contain information that a healthcare professional who is unfamiliar with the case is provided, adequate information regarding the indications of the examination, type of examination performed, and the results of the diagnostic study. The final report must be standardized. All physicians interpreting non-invasive vascular examinations in the facility must agree to and utilize uniform diagnostic criteria and a standardized report format. Interpretations must include review of all examination data, including measurements, images, and recordings. The final report must accurately reflect the content and results of the examination. It must be verified and signed by the medical director or a member of the medical staff listed in the application. The final report must be typed and must include patient identification, date of the examination, appropriate clinical indications leading to the performance of the exam, name of the examination and its integral parts, and adequate description of the exam performed. The final report must include a description of a pertinent positive and negative findings, including velocity measurements. If disease is present, it must be characterized according to its location, extent, severity, and etiology whenever possible. The final report must include incidental findings, reasons for technically limited, suboptimal, or incomplete examination, a summary which includes impression and conclusion of findings, comparison with previous related studies whenever available. The final report must also include the physician's name. It must have a signature of the physician and/or electronic verification, date of interpreting physician, signature, or verification. The interpretations must be available within 2 days of the exam. An interpretation can be in the form of paper, digital storage, and voice system. Final verified signed reports must be available within 4 business days. Identification of the technologist performing the exam must appear as part of the permanent record. If preliminary reports are provided, the preliminary nature must be clearly indicated. A policy for communication of any significant changes must be defined for those situations in which the final interpretation differs substantially from the preliminary findings. A policy must be defined whereby the results of the examination that demonstrate urgent or life-threatening findings are communicated to the attending healthcare professional in a timely manner. Look for future short topics presented by the IAC, and let the IAC vascular testing experts be your full-time consultants. Thank you for joining us today.